promotes behavioral health describes in an article on their website that was published February 2nd of 2018 a story about Annie. Annie is a 20-year-old single female who suffers from major depressive disorder and substance abuse disorder. She was spiraling downwards until she came across a treatment known as dialectical behavioral therapy. Some of the people in this room may know someone in a situation similar to Annie's, someone who suffers from major depressive disorder or someone who suffers from depression. Dialectical behavioral therapy is useful for people with various mental disorders. Today, I will first be defining dialectical behavioral therapy. Second, I will explain how it is used by individuals with various mental disorders. I'm going to begin by defining dialectical behavioral therapy. Dialectical behavioral therapy is a process that can be broken down into 4 steps. The first step is group therapy. Group therapy covers 4 modules. The first module covers mindfulness. Mindfulness is considered the most important module that is covered according to Joachim Soler, a clinical psychologist and other authors in their book of Behavior Research and Therapy that was published in February of 2012. The second module covers emotion regulation, according to Sarah E. Valentine, a professor of psychology at Boston University, and other authors in an article that was published in the Journal of Clinical Psychology in 2015. The third module covers distress tolerance skills, and the fourth module covers interpersonal effectiveness. Individual psychotherapy is the second component in the DBT process. Individual psychotherapy consists of 1-hour weekly sessions of therapy for an entire year. And according to Chelsea Wilkes, a postdoctoral scholar at Harvard University, and other authors in an article that was published in the Journal of Cognitive Behavioral Practice in August of 2017, it is required that you go through with all of your hours of therapy before you can graduate from the dialectical behavioral therapy program. The third component in the dialectical behavioral therapy program is called phone calls. This means 24-hour phone coaching that is available for the patients going through with the DBT program. And according to Valentine, as previously cited, this is very common for those patients that are going through with the DBT program to use the phone calls. The fourth and final component in the DBT program is consultation group meetings. Consultation group meetings are used to address motivational issues that may be preventing effective treatment. Now that I have defined dialectical behavioral therapy, I will now explain how it is used by individuals with various mental disorders. The most common users of DBT, or dialectical behavioral therapy, are those who suffer from depression, anxiety, or personality disorders. The most common used module in the DBT program is mindfulness, as I stated before. This is really helpful for those who suffer from anxiety. Also, according to Chelsea Wilkes, the postdoctoral scholar I mentioned before, in a separate article that was published in the U.S. National Library of Medicine and the National Institutes of Health on October of 2017, there is evidence that DBT has led to decreased suicidal behavior in those high-risk individuals. And according to Valentine, as I previously cited, dialectical behavioral therapy was originally created for those who suffer from borderline personality disorder. It was shown to improve emotional dysregulation and discontrol, which is a common factor in borderline personality disorder, but also is very common in other mental disorders. Today I have defined dialectical behavioral therapy and explained how it is used by different individuals with various mental disorders. Dialectical behavioral therapy is useful for individuals with various mental disorders, just like individuals like Annie. Annie has now completed her program and has stopped taking pain medication. She is focusing on going back to school, all because of dialectical behavioral therapy.